Hi there, I'm Raya from Active Health Clinic, and today I wanted to speak to you about the benefits of wearing compression. Now, the Australian Institute of Sport actually indicate that the benefits of wearing compression can include reduced muscle soreness by around 47%, increased blood flow to the muscle by around 18%, and actually a reduced heart work rate by around 2.5%. Okay, so that's actually pretty significant. So in general summary, compression aims to support and promote blood flow throughout the body. Now, when we're talking what compression actually is, and in very simple terms, and I know this is very straightforward, but compression aims to compress the blood vessels, which means technically it's kind of a smaller pipe or a narrower pipe rather than a wider one. So we know that when we're talking blood flow, it has to work against the element of gravity, which means sometimes it struggles working uphill. So if we have a wider pipe, that's a bit more difficult. If we have a narrow one or a compressed one, that actually helps support blood flow just that little bit better. Okay, now this is actually why, for that very reason, this is quite a common management strategy for dysautonomia, orthostatic intolerance, and postural orthostatic tachycardia syndrome, and all of the associated conditions. Now, as we know, they are all conditions that are poor promotion of blood flow or regularity of blood flow throughout the body. In certain cases, this might be a drop in blood pressure. In others, this might be a rise of heart rate, or both. And basically, it's your body's inability to efficiently promote blood flow back up to the brain. Okay, so when we pair that idea, or what we know about dysautonomia and OI, and what we know about compression, when we put that together, it makes a lot of sense. Compression aims to promote blood flow, which means it's actually minimizing blood pooling in our lower limbs. It's helping with that circulation. And in doing so, it's therefore decreasing the demand and the intensity of the body to try and get blood flow back up to the brain. Okay, so we're also talking medical grade compression. We're not just talking compression being a fit. Medical grade compression will actually have a reading of compression, which actually will be, in terms of the effectiveness for dysautonomia, OI and POTS, we are looking for 20 to 30 mmHg. Okay. Now, compression itself is a management strategy for dysautonomia, OI and POTS, but generally this is in conjunction with other strategies. Now, you may have also been suggested to do things such as hydration, electrolytes or salt, pacing of your postures, movement or medications. These all have their different elements of effectiveness or supporting the body in the different difficulties it may have in experiencing these conditions. So compression will be one of many strategies that we utilize for something like dysautonomia, but it's also one of the more passive strategies that we may have. We put on the compression, it is helping the body do what it needs to do at ideally a lower intensity than what it would do without the compression. Okay. Now, I will say, I did say passive, but I am very well aware that compression is very tight, so it is an active activity to put compression on and off, but generally the benefits of wearing the compression, if you have these conditions, will outweigh the energy expenditure it takes to put the compression on and off. So I hope that all makes sense, and I hope that answers your questions when it comes to compression and why it's effective for these conditions. Please do feel free to comment below if you have any questions, or if you'd like us to discuss this in further depth, we are more than happy to. So I hope you have a lovely day and look forward to hearing from you soon. Bye.